Hi, I am Dr. Harv, one of the elite ICE 50 avatars to present this course on dental malpractice and closure of dental clinics by Ginsberg and Associates trial lawyers. Each year, thousands of Americans sustain minor to severe injuries due to the actions and inactions of negligent dental practitioners and nurses. Dentists, like all medical professionals in the healthcare industry, have a legal obligation to provide each of their patients with a reasonable level of care. When this accord is broken, the patient may suffer injuries and health complications that warrant a medical malpractice claim. What constitutes dental malpractice? Dental malpractice serves as an umbrella term for a variety of injuries and acts of misconduct. For example, a dentist can be held legally responsible for pulling out the wrong tooth or completing an extraction that results in nerve damage. In either scenario, the wrongfully injured patient would need to endure additional and costly surgeries just to rectify the damage. By filing a medical malpractice claim, the patient can recover compensatory damages that account for their existing and projected medical expenses, pain and suffering, lost wages, and more. Other valid examples of dental malpractice include 1. Failure to diagnose oral diseases and other medical conditions. 2. Delayed diagnosis or treatment of an oral disease. 3. Defective crowns and bridges. 4. Failure to take a patient's medical history into account. 5. Anesthesia errors. 6. Injuring the jaw or sinus cavity during surgery. 7. Failure to properly supervise negligent employees. 8. Inability to properly treat conditions. 9. Acts of intentional misconduct. 10. Failure to refer a patient to a specialist. The Department of Health has the legal authority to close a dental office if it fails an inspection. Sometimes multiple reports of unsanitary conditions prompt the agency to engage in a detailed investigation. If this happens to your dental office, it's important to seek alternative medical attention as soon as possible. You should undergo tests to make sure you haven't contracted HIV, AIDS, hepatitis, or any other diseases. On the other hand, a patient can't file a dental malpractice claim just because they're unhappy with the final alignment of their teeth. You can be displeased with your current dentist, but that doesn't necessarily mean you have grounds for a claim. On December 7, 2018, 3 Philadelphia dental practices, all true family dental clinics, were closed down due to unsanitary conditions. Investigators from the health department visited the clinics after receiving a tip about the locations not observing best sanitary practices. According to Dr. Stephen Alice, the Director of Disease Control with the Philadelphia Health Department, the sterilization and handling of used instruments on patients was not being cleaned appropriately or in a timely fashion. Officials are concerned because roughly 1,500 patients may have been exposed to HIV, hepatitis B, and hepatitis C. Each of these patients should have been notified about the situation by December 7, 2019. Unfortunately, it can take years for symptoms to surface, so it's important that these patients diligently monitor their health and schedule regular checkups. Legal release. The views expressed in this article do not necessarily reflect those of ICE 50. One must consult with their legal representatives for any and all legal advice regarding content, errors and omissions, regulatory changes of law and jurisdiction that you practice in.